Hello, everyone. I'm Dr. Mohsin Ansari, practicing physician and diabetologist in Mumbai. On this occasion of World Heart Day, 29th of September, I would like to brief you about dyslipidemia, which is one of the major risk factors for heart disease. What is dyslipidemia? Dyslipidemia is nothing but an abnormal level of cholesterol or fats in the blood. Basically, cholesterol is a type of fat which is found in our blood cells and our routine body system. It is basically essential for good health and maintenance of cell function. However, when the body fat is in excess, it tends to build up in the blood vessels, which attracts blood clots and reduces the blood supply to the major organs in the body. There are good cholesterols as well as bad cholesterol. Good cholesterol, as we know, is HDL or high density lipoprotein, which protects us from heart disease and paralysis at death. The other form, that is low density lipoprotein or triglycerides, are considered to be the bad cholesterol, which are one of the major risk factors for heart disease and other cardiovascular complications. Now, in dyslipidemia, there can be a variety of combinations which we can see. Some are genetic, some are acquired. There can be an elevation of LDL, which is the bad cholesterol, elevation of triglycerides, or low levels of HDL, which is a good cholesterol. Now, most of the patients with dyslipidemia may not have any symptoms. Or when patients come to us for vague symptoms like chest pain or routine checkup or for health checkup, we find there is elevation of cholesterol. Now, it is necessary to do a routine blood checkup to detect your cholesterol levels, especially when there is a family history of heart disease, paralysis attack, diabetes, or high blood pressure. Or if your job profile doesn't permit you to maintain a healthy lifestyle, it is good to do a blood check for cholesterol and sugars. Cholesterol, of course, is a hot topic. It is still debatable. Okay, what exactly are the good cholesterol? What are the normal levels of cholesterol? And what are the risk factors associated with high cholesterol? There are various classifications which categorize your risk when you have high cholesterols. Now, in order to control your blood cholesterol levels, I would like to brief you upon certain steps to maintain your cholesterol in good health. First of all, your eating habits. Cholesterol, most of the time, is a lifestyle disease. So first, limit your food intake which are high in saturated fats. Saturated fats basically come from animal products such as cheese, the fat portion of meats, dairy desserts, and oils like coconut oil or palm oil. So foods that are high in saturated fat must be consumed less. Certain saturated fats like ghee, when consumed in limit, are good for health. Choose foods which are low in saturated fats. Avoid foods that are high in trans fat. Trans fat is seen especially in the deep fried foods like potatoes, vada pav, bhajia, or the farsans that we eat. Avoid foods that contains excess of salt and added sugars. Examples of this include like lean meats, preserved seafoods. Eat foods which are fat-free. For example, low-fat milk, good quantity of cheese and yogurts, whole grains, fruits, and vegetables. Except those foods which are high in sugars, like chiku, pineapple, and banana. Eat foods which are naturally high in good quantities of fibers, like oatmeals, beans, and unsaturated fats, which can be found in things like avocado, olive oil, and nuts. These foods tend to maintain your level of bad cholesterol in limits. Eat only enough calories to maintain a healthy weight. Foods like fruits, vegetables, whole grains, beans, peas, nuts, and seeds like flax seeds help to lower your bad cholesterol. Next step is maintain a healthy weight. Being overweight and obese increases the chances of bad cholesterol. If you burn your calories, maintain your body weight to near normal, the chances of building bad cholesterol in the body are lesser. Lowering weight also helps to reduce your blood sugar levels, controls your blood pressure under control, and overall gives a good health benefit. Go for regular exercise. In a busy life schedule, we may not be able to go for regular walks or gyms, but at least try to walk or have a physical activity, brisk walk of at least 30 minutes, or not all days, but at least most of the days a week. All this will tend to maintain your good cholesterol, that is HDL, to a little higher level and brings down your blood sugars and blood pressures. Take part in activities that tends to raise your heart rate, which in turn burns the calories, like brisk walking, running, swimming, biking, or dance classes, Zumbas. Losing just 10 to 15 pounds can lower your LDL cholesterol and triglycerides level. Quit smoking. Smoking decreases the good cholesterol in the blood. So quitting smoking, reducing the intake of alcohol helps to manage your cholesterol in a better way. There are certain diets which contain good amount of vitamin D, which help to control the cholesterol to good levels. So diet which is high in vitamin D or taking supplements with the help of medications containing high doses of vitamin D will keep the cholesterol under check. Also, do not tend to ignore thyroid disease. Thyroid is also one of the underestimated causes for high cholesterol. Once you're diagnosed with high cholesterol, the doctor will categorize you for the risk of heart disease and may prescribe you medications or only lifestyle modification, as I have said. But once you have prescribed your medications, take your medicines on time. It is not just medications, but diet, exercise, and taking medications on time will help to keep your cholesterol under control. Also, do not tend to ignore sugars. Even though you are young, consuming diet which are low in sugars tends to reduces the inflammation in the body and helps to keep the cholesterol under check. Whatever excess sugar that we consume eventually is converted into bad cholesterol or triglyceride. So keeping your sugars under check will also help to tend to reduce your cholesterol levels. So on this occasion of World Heart Day, my message to all is eat healthy, eat well, smile always, take your medications on time, consult your doctors regarding diet management, and reduce the level of stress in your life. Jai Hind.